we need to think about how we organise our social care package better, if you remember, and how we make sure that we look after people better who are in social care. I think we discovered too many care homes didn't really follow the procedures in the way that they could have, but we're learning lessons the whole time.
The Prime Minister's been accused of trying to shift the blame for coronavirus deaths onto care homes. Boris Johnson said on Monday that too many of them didn't really follow procedures. Vic Rayner, the Executive Director at the National Care Forum, says the comments were insulting as care homes followed the guidance to the letter.
Well, I have been pretty distressed really to hear his comments and the suggestion that he appears to be making that care homes had not followed procedures during the COVID outbreak. It feels to me, I work with lots of members and lots of organisations across the country who have done their absolute focus has been on ensuring that they comply with those government guidelines. Those guidelines themselves have changed repeatedly. There's been huge amounts of guidance that have come through from government for care homes and care settings more broadly to adapt to, and they've done a phenomenal job of doing that. So I think to hear the government and the Prime Minister particularly suggest that they haven't been doing that was very insulting and very damaging actually in terms of people's feelings about how supportive the government is of their work. So the sacrifices, the efforts that they've made have been dismissed or put down in some kind of way. So there's some very immediate kind of anger around that. And care workers particularly, but also those running care organisations have been phenomenal in the face of this very extraordinary and challenging pandemic. I think what people will hear is the words that were said, and that's very difficult to move back from.
The national effort on PPE during the height of the pandemic was focused on the NHS. Ms Rayner believes despite international evidence there was delays in the guidance from the government.
There certainly was much of the early focus was around hospitals, the development of the Nightingale hospitals, and obviously the discharge of people out to the community, some of which came to care homes. And I think whilst I understand some of that might be having looked at what was happening in the international community, which is often what ministers and others say, there was also a huge amount of international evidence emerging about the impact of coronavirus on care homes. You only had to look to Washington State in the US, to what was happening in Spain, particularly to identify very early on that care homes were, and people, importantly, the people living within them, were at significant risk. So I think we, in relation to the guidelines, I think there were certainly delays in the development of the guidelines, but probably much more importantly, delays in terms of us having the right data to evidence and understand what was happening in those homes.
One of the most important things is to fund them properly. So we're putting another 600 million into COVID compliant care homes, but we'll also be looking at ways to make sure that the care sector long term is properly organised and supported.
The head of NHS England has called for reform in social care within the year. Vic agrees and welcomed the Prime Minister's comments on reform, but feels the hard work already done is being forgotten.
The need for reform and the need for additional funding for the sector, and I absolutely welcome those bits of his comments. I think it has to be, though, alongside the spirit of recognising the work has been done already within the sector and recognising that you need to take this very large and significant part of our communities forward with the government in a partnership for the reform that we all need and all have been asking for to be effective.